The divide grows between the governor and the legislature. Joining us on Columbus on the Record this week, Joe Ingles, State House reporter for Ohio Public Radio, Gene Krebs, former state legislator, and Derek Clay, Democratic strategist. After nearly a year of complaining about Governor DeWine's health orders, the Ohio legislature has decided 132 lawmakers are better able to issue emergency orders than the state's chief executive officer or local health officials. The House and Senate this week overrode Governor DeWine's veto of a bill that limits his ability to issue state orders. The law allows the legislature to immediately reject or change any state health order. It limits local boards of health ability to issue health orders. The legislature would also have a say in extending or ending states of emergencies.
I think that this is a bill that restores rights and freedoms of the state of Ohioans and restores the ability of this sacred chamber to be a part of that process.
And I am telling you all that this is dangerous. This is ill-conceived. This is unnecessary. And then to hear, on top of all of that, it's a fight with the governor because you're upset he didn't call you. I mean, I thought we all got past people not calling us in high school.
Gene Krebs, you were once one of those 132, 99 in the House, 33 in the Senate. Should they have immediate veto power over a health emergency? Is that wise public policy?
When you look at the current COVID virus, it has a 2% mortality rate. When you look at the historic flu, it's a 0.1%. The danger here is that previous to COVID, there was a disease related to it called MERS, M-E-R-S, that came from camels and crossed over into humans. It had a 35% mortality rate. Fortunately, it was not highly transmissible. The problem is going to be is that the next one could be something that is as transmissible as COVID and as deadly as MERS. At that point in time, you do not want to have a collection of 132 people trying to step in. What you're seeing more than anything else is just pure political theater. When you read the fact that the Legislative Service Commission said early on this bill had profound constitutional issues, but they went ahead and did it anyway, means that everybody's going to be able to walk away from this and they're going to be able to declare victory. One of the things that is incumbent upon us on this show is kind of the curtain so you know what's going on behind the all this brouhaha you see. In doing it this way, then if you monitor the Facebook pages of those legislators, you see regularly they have 400 constituents yelling at them to impeach DeWine by Tuesday of next week. All right. At the same time, they also know that as this is probably going to be immediately overturned in the courts, so they can do this. They look good to their constituency. And at the end of the day, there's no real harm done, they think.
But Derek Clay, this is now the law. It takes 90 days for it to go into effect. And yeah, there's some constitutional questions here, but what if the Supreme Court does not overturn this, at least not right away? This is the law. Derek Clay.
It is a dangerous precedent that has been set by the legislature. And, even more so than anything, this has empowered the GOP legislators. There's a supermajority in the legislature in the House, in the House and the Senate. So now with these legislators feeling emboldened by this veto override, they now can do basically anything they want. They feel like that they are above the governor. So if they put a piece of legislation out, and the governor doesn't like it, then they can use their veto override to override his decision. So this is a very dangerous precedent, and it's just not a wise one for the state of Ohio.
Joe Ingles, the governor did try to force a last-minute compromise in his veto message, and he tried to find some kind of middle ground. We heard Minority Leader Sykes say this is because the legislature didn't get a call from the governor. Was it really just that, a lack of communication? Why was there no middle ground here?
Well, I don't want to weigh in on what they were actually thinking and whether that's true or not, but I think that there is an element that the lawmakers feel like they're not being heard and that they have concerns that aren't being addressed. That being said, there are, if you get a bunch of lawmakers together on any given day, it's not quick to get legislation passed. I mean, nothing happens on a dime in the legislature. And so that's one issue. I think the other issue with this is it's going to end up in court.
Yeah, the governor says he intends to, but it's 90 days. I guess they still could strike a deal. I'll get to that, Gene, with you. I mean, the pandemic is so different. This isn't an overturned tanker that's leaking a chemical or a Legionnaire's outbreak in a nursing home or a school. This is a statewide pandemic that was going to last months and months. And could you see a compromise where, okay, the governor has a chance to issue the executive order, shut things down for, say, 90 days, but then after the 90 days, it takes, say, a 2/3 majority from the legislature to overturn that order? Why couldn't something like that have been worked out? Would lawmakers have gone for that, or was it all or nothing?
They could have, but remember, that was not offered. And the reason it was not offered, I believe, was so that everybody could claim victory and walk away with still essentially the status quo intact. Because these types of laws we've had have been in effect since the 1880s when we had cholera and diphtheria outbreaks. So these types of diseases are new to us, but we have very short memories, and we need to realize these laws have been there for 140 years for a very good reason.
Derek, should the law, for a health order that's gone on for months and months, shouldn't lawmakers have some kind of a check and balance power on the chief executive? Because you could see how possibly down the road it could be abused. With a worldwide pandemic, I don't think it's been abused here, but you could see the possibility where that order, that power could be abused. Should there be a time limit where lawmakers can chime in?
Checks and balances are always good when you're dealing with government, no question about it. But again, we're in a nationwide pandemic that we haven't seen for 100 years. Everything that we have done everything that this governor has done, in my opinion, has been for the good of Ohioans. There are reasons why you have public health officials in place that give these types of orders. It's not like they're doing this willy-nilly thing where they're just throwing out orders whenever they feel like it. I mean, this is a national pandemic that we're in. People are dying. You had every single hospital and health agency across the state basically pleading with the legislature to tell them not to do this veto override. And they did it because they had a political ego and a chip on their shoulder.
Joe Ingles, 90 days before this, what's like 88 days now before this goes into effect. Do you expect any kind of deal making in these 90 days, or does the governor just go to court and hope that the Supreme Court or whatever court he goes to nullifies this?
There is always deal making to be done at the State House, and we know that for sure. But I think, the governor is looking at court, and he's said so much. So, who knows? I don't know how to answer that question other than to say that there are a lot of questions out there about this bill, and if they don't get answered, a court is going to be in the position of answering them.
Yes. All right. Governor DeWine says he will cancel all of the health orders once Ohio gets down to 50 cases per 100,000 people for 2 weeks straight. For a while, that rate was dropping pretty fast, but progress has stalled. In fact, this week, the new case rate went up to 149 cases per 100,000. DeWine says the key to getting out from under the orders is to get those shots in the arms.
We're going to move pretty quickly from a point where we didn't have enough vaccine until we do have plenty of vaccine. And then the question is, can we reach that herd immunity? Can we get enough people vaccinated? Will enough people be willing to be vaccinated?
Next week, the state expects to have more than 500,000 doses to administer. And starting Monday, everyone 16 and over can get a shot. Joe Ingles, he didn't say it directly, but he seems a little concerned that the problem now is not getting the vaccine to people, it's getting people to get the vaccine. How much of an issue might that be in trying to get this case number down?
Well, that's true, Mike. There is a problem with people getting the vaccine in some areas. In other areas, you see a lot of people going out of their way to try to get the vaccine. So we have, two Ohios right now, one that wants the vaccine and one part of Ohio where people are driving away from Columbus to go out to a far-flung place to be able to get a vaccine. So, but the problem is that once everyone who is pushing to get the vaccine right now, once they get it, then we're going to see a situation where we've kind of, we've got this big group and you've got to figure out how you're going to reach them to get the vaccine. And I think that's what Governor DeWine keeps alluding to in these press conferences with the hesitancy. He's wanting the people who are getting the vaccine to talk to their friends and neighbors about why they did it, why other people need to do it. And it's something that needs to be addressed. And right now, the state is addressing it by trying to move things around a little bit, but that's only going to hold for so long.
Gene Krebs, you're out there in rural Western Ohio. What's the mood out there among your neighbors as far as their willingness to get the vaccine? Are they eager? Are they hesitant?
Well, I think the data indicates that they're very hesitant. Preble County, 40,000 people, and has more livestock than it has people, has had people from neighboring counties drive in to get the vaccine here because there's lots of availability that they find themselves locked out of in Montgomery or Butler County. And it's becoming, it's a source of irritation by my neighbors and relatives, which is about the same thing. And they've been expressing some anxiety over everybody else coming to get their vaccine. But if they're not taking it, then it's okay. I tried to explain to them, then it has to go to somebody.
Yeah. It might get wasted if otherwise. Why the reluctance? Is they're not sure of the science because it was developed fairly quickly? They say all the processes were followed. It just the timetable was shrunk. Are they just worried that it's possibly dangerous down the road?
All of the above. It's all of the above. I've heard this from every single thing that you've mentioned. It's wasn't vetted properly. Bill Gates is going to, and George Soros are involved in it. And I tell them, yes, but George Soros is already tracking you through your cell phone. Okay, so don't worry about getting it through your vaccine. I try to use humor on them, as you can tell, and it doesn't do any good. You're trying to convince somebody of something to change their mind is an extraordinarily difficult job that requires people who they already will listen to. And usually in America, that involves celebrities. And to my neighbors and relatives, I'm just Gene. I'm not a celebrity, which is why they're now broadcasting Anthony Munoz, former Cincinnati Bengals star, doing a pro-vaccine ad down here in Southwest Ohio.
Derek Clay, what they need. Now, President Trump did get the vaccine. He said through a press release, because he's not on Twitter anymore, that people should get the vaccine. But if he did a television ad saying get the vaccine, that might help, right?
Well, I'm sure it would, but he should have did that, a year ago when he had even more influence to get people vaccinated. Listen, the bottom line is, there's about 14% of our population that has been vaccinated thus far. 3 of my colleagues just today told me that they drove over an hour and a half to get the vaccine. And, the vaccine is out there and it's available if you want to get it. Now, minority populations have been vaccinated at a lesser pace than the rest of the state. They're at around maybe 5% vaccinated. So, we got to find ways to make sure that people have the necessary transportation. If they don't have transportation to get vaccinated, there may be some confusion out there about how to actually schedule the vaccination. So, I think that we're doing everything that we know how to do. We just got to make sure that we are broadcasting that to folks in various different ways.
Derek, does it frustrate you that you hear of cities like Lima or rural areas, they have too much vaccine and they're trying to get people in to use it up before they waste it? And there are other places where people are having to drive 2 and 3 hours to get the vaccine. Should that formula be tweaked on where it's distributed?
Well, I think that the formula definitely should be tweaked. It should be looked at. If we got so much technology out here that we can tell whether people are getting the vaccination and how many vaccines we have left. If we can ship that to a different place, people can get vaccinated more quickly. We should definitely be looking to do that.
Joe Ingles, has the administration, the DeWine administration, looked at the formula, what's working, what's not? Have they tweaked it since they started giving out lots of vaccine or making it available?
Yes. They have tweaked the vaccine some and taking it from areas where it's not popular, putting it in other areas. And one thing they did this week is they told some of these areas, the health districts, the pharmacies that weren't able to fill their spots with the existing eligible people. They said, you know what, go ahead and whoever wants it can have it. And as long as they're, over 16. And the 16 and 17-year-olds have to have Pfizer. 18 and up, you can have any of the vaccines that are out there. But Governor DeWine said, you know what, it's not that long until the 29th when everyone would be able to get it anyway. And he said by opening that window to more people, that will help in those areas where they don't have enough people to take the vaccine. But he has said that he's made some tweaks there and he might have to make more.
Yeah, just anecdotally hearing today that many younger people, the ones under 40 who are still not eligible technically until Monday, they've been making appointments and they're filling up fast. So that's a good sign as far as getting more and more folks vaccinated. President Biden made a quick visit to Ohio this week to tout the COVID relief package and mark the 11th anniversary of Obamacare. Biden toured the James Cancer Center at the OSU Medical Center. The facility used $100 million in Obamacare money to expand its radiology oncology treatment center. Biden said the COVID relief package is one way he wants to improve the Affordable Care Act.
We have a duty not just to protect it, but to make it better and keep becoming a nation where health care is a right for all, not a privilege for a few.
Derek Clay, Republicans said that Joe Biden was, quote, spiking the football with his visit to Ohio this week, also Pennsylvania. Are they wrong?
No, he should have spiked the football and threw it in the stands. I mean, listen, we are at a point right now where help is here. Help is finally here. The former administration had plenty of time to do the same types of things that President Biden is doing with this America relief package. Former President Trump had both the House and the Senate under his control. He could have did these things that are actually pumping money back into the economy, and he just did not do that. So now we have a president who actually cares, who actually has put forth a package that's not only going to put money in the pockets of Americans that need it, but money into the economy that will actually jumpstart our economy.
Gene Krebs, the president seems to be going around Republicans, leaders. He's going to go around the leaders directly to Republican voters because polls show that a simple majority of Republican voters support the COVID relief package, even though it's hugely adding to our deficit. Is that a wise strategy? Will that work?
I think what you're seeing is the emergence of a new Democratic Party strategy, which is unlike the days of FDR and LBJ, where it was always about come up with a new program. Now they're doing direct wealth transfers. And that's much harder to argue on a certain conservative level because you're cutting out all the bureaucracy and you're empowering people to spend the money in the way that they think is actually best. And so what you're getting here is FDR with a little bit of Ronald Reagan at the same time. And I think that's what they're finding so difficult to push back against. And that's why it has about a 62% support by Republicans in polling. I'm floored. I never anticipated this being so popular amongst my fellow GOP.
Joe Ingles, but the bottom line is this is adding a tremendous amount of money to the deficit and the debt. And the hope is that the improved economy will spur economic growth, spur tax revenue, and pay off some of it. But the fear is that tax hikes are not too far down the road. And even Biden says he wants to tax corporations and folks making more than $400,000 a year.
Yeah, it's very possible that we're going to see some tax hikes or at least some tax reorganization going on here. I think that's something that he promised in the campaign, and it's something that he will probably attempt to do, especially now that he has the Senate. And he'll want to do it quickly while he still has the Senate. I think the thing that we need to remember in all of this, though, is that the Republicans also have put forward some pretty ambitious and bold spending programs for coronavirus. So this new one, yes, it's big, but the ones before have been pretty big too. And a lot of economists say that if you don't go big and try to get out of this, that you're going to have bigger problems down the road when you're trying to get the economy to recover. So there's two ways of looking at this. And I think that that's what we're seeing now is Democrats saying, well, we really need to spend right now so that we can get on our footing and be able to get the economy breezing along. And
the tax cut approved by former President Trump and GOP lawmakers was also very large as well. Our last topic, Ohio lawmakers have approved spending more than $8 billion to pay for transportation projects over the next 2 years. The money will pay for roads, bridges, public transportation. Unlike 2 years ago when they battled over increasing the gas tax, there was very little controversy among lawmakers this time around. They decided to spend more on public transit than Governor DeWine originally proposed, which is the one wrinkle in this anyway. Joe Ingles, really not a whole lot of controversy here. This is sort of the nuts and bolts of governing, fixing the roads, fixing the bridges, and trying to take care of the buses. And we don't have subways, but pretty easy sailing here.
Yes, and we need to remember that Governor DeWine really proposed chopping public transit down to almost nothing. And so what they've done is they've restored some money for public transit. We also need to remember that in our cities particularly, having public transit is a way to keep people employed. A lot of people depend on public transit, and if you don't have it, it's a problem. And they've also been, these bus systems, they've all been dealing with coronavirus issues. It's been more expensive for them to operate. So they're coming to the lawmakers and saying, we need help. And the lawmakers are saying, we hear you.
Gene Krebs, is that a wise investment? The pandemic will end someday, but right now a lot of folks don't want to get on crowded buses. We're seeing in large cities people are not getting on the subway. They're getting in their cars or they're walking to work if they can. Is investing in public transportation right now the way to go?
It's actually a workforce issue more than anything else because if you talk to businesses, this is one of the key ways for their employees to get around. What you're seeing right now, and Ohio State had a beautiful study on this, came out back in, I think, November or December, that they looked at all the big cities that for transit and buses and things of this nature, the low-income folks were still taking transit. It was the white-collar worker, the office worker who was now working from home. It was not taking transit. So in other words, the ridership shrunk, but the importance of it became even more magnified in a time of declining revenues and declining economic opportunities. And if you talk to folks at the Chamber of Commerce or the Ohio Manufacturers Association, they will tell you getting their workers to work is a key aspect of this, and they need to have effective transit for workforce development. But surprisingly, not enough people seem to grasp that.
Derek Clay, real quick, is with this, plus we expect Joe Biden's infrastructure plan, could we see really a expansion of mass transit, light rail, intercity rail?
Interestingly enough, Mike, a representative from Amtrak approached the Mid-Ohio Regional Planning Commission about possibly bringing a passenger train line to Columbus. So, this infrastructure package, this transportation bill is definitely going to, pay for roads, bridges, and public transportation that we desperately need in our state. And the bottom line is, as Gene alluded to, public transportation is such a critical workforce issue that we definitely need to fund. It's taxpayers' money.
All right. Let's get to our final off-the-record parting shots. And Gene Krebs, you're up first.
Too many of my Republican colleagues are hoping that this is going to be a good midterm for them because it's always a good midterm for the party that's not in the White House. My cautionary note to them is to look at the 1934 election midterm, because that was overwhelmingly for FDR's party, who was holding the White House, and they actually picked up 10 U.S. Senate seats. So I think you're suffering from some overconfidence, and I think you need to go ahead and work harder and smarter.
Derek Clay.
Longtime Columbus City Councilwoman Priscilla Tyson announced her retirement today. At the end of the year, she's going to be stepping down, which is going to create a seat on Columbus City Council in a political shuffle in our city.
All right. And Joe Ingles.
I think we're going to start to hear more about herd immunity. We're going to hear more about vaccinations, less about masks, and more about vaccinations, because as we get to the point where everyone who's had wants the vaccines had the vaccine, we're still not going to be at that point where the scientists say we need to be to have herd immunity. So I think that's going to be the next thing to watch.
All right, the legislature has done it. They've taken away the subsidies for those 2 nuclear power plants up in northern Ohio, the subsidies that caused all that trouble. Now it's on Mike DeWine's desk for his signature. My guess is he'll sign it, and then it'll all be for naught, except for the $61 million bribery scandal. That's it for Columbus on the Record for this week. Check us out online, Facebook, Twitter, and you can connect to us at wosu.org/COTR. For our crew and for our panel, I'm Mike Thompson. Have a good week.